We have what's called a post-operative pathway where we try to get the patient a maximum a chance at a good, swift recovery. So to answer your question, every patient, they'll wake up with a chest tube. That chest tube is pulled out at the earliest time, with the goal being a post-op day 1 or post-operative day 2 chest tube. The patient will get daily lab work and a chest x-ray to make sure that the lung's re-expanded and looks as it should. And once the patient is up moving around, doing well with their diet and feeling better, we will discharge that patient home. Usually that falls around post-operative day 2 to 4. When they're in their hospital, they usually go to a step-down unit, and it's a multitude team approach. So not just the surgeon, but the nurses, physical therapy works with you to maximize recovery and expedite the recovery. And it's usually a 2 to 4 day stay hospital in the step-down unit with the goal of ultimately getting the patient home within the first 3 to 4 days. So even it's minimally invasive, so the pain is much reduced compared to traditional open surgery with namely a thoracotomy. We do treat the patient's pain post-operatively, and we also, before we close the patient at the end, we perform what's called intercostal nerve block with a long-acting local anesthetic that helps greatly reduce the post-operative pain control. Having said that, it is reasonable to expect some soreness and some pain post-operatively that gradually gets better and even goes away within the first 2 weeks after the operation. I see the patient in the office within 1 week of discharge. And there's been actually literature to show that improves outcomes long-term of lobectomy patients being seen within a week. So I do that, and as long as they're doing okay, I'll see the patient 2 to 4 weeks after that initial post-operative visit. And if we do the lobectomy for a lung cancer surgery, a lot of the times the final pathology will determine whether or not what the final stage is after taking the lobectomy, all the lymph nodes. And some of those patients, if they fall in post-operative stage 2 or stage 3, will be referred for potential chemotherapy. If they're stage 1, we follow them with CT scans every 6 months for up to 5 years to ensure that the cancer doesn't return. So I follow that patient a minimum 5 years after the surgery, periodically. Yes, well, our cancer patients all get what's called a multidisciplinary approach. So even if they don't need chemotherapy after, I still refer that patient to oncology for evaluation, another set of eyes, if you will, to make sure that all the T's are crossed and I's are dotted. So it is a multidisciplinary approach, not just with the thoracic surgeon, but with the oncologist. Radiation oncologists sometimes will be involved to help manage care of these patients, and pathology as well.